Kia ora, we're here at the Rural National Health Conference and I've got with me today Bryan Betty. Bryan, welcome.
Thank you, Carrie.
And you're a GP from East Porirua.
Yes, and I'm a GP at Porirua Union Health, which is in Cannons Creek, East Porirua. So my practice base is predominantly Maori and Pacific, and I've been there for about 10 to 15 years now, on and off.
Wow, really?
Yeah,
oh, that's neat.
Yeah.
Cool. And your talk today, you're coming from a Pharmac perspective.
Yeah, because my other role, which I took up about 3 years ago, is as Deputy Medical Director at Pharmac. So I'm essentially the Medical Director for primary care at Pharmac. So the talk today is essentially about, I suppose, Pharmac's role in the sector and some of the issues around funding medication in New Zealand.
Okay, now please enlighten me. Can you run me through Pharmac, its sort of background and what its role is in New Zealand?
Yeah, so Pharmac is what we call a Crown entity. That is, it's obviously responsible to the government, and essentially it decides what medications patients can access that are subsidised in New Zealand. So when you go to see your GP or specialist or whoever it is, and they write a script and you go to the pharmacy, Pharmac actually decides which medications you can get for your $5 co-payment versus which medications are off the list. Yeah. So it decides which medications we get access to.
Okay, and does that renew like every so many years, or how does that?
Well, it's quite an extensive process. You know, Pharmac runs a model that's based on a very extensive clinical advice network. So we run a lot of subcommittees in specialist areas such as rheumatology, cardiovascular, diabetes. They give advice to a committee called the Pharmaceutical Therapeutic Advisory Committee, which then advises Pharmac on the evidence around medication and what medication we should start to consider for funding.
I see.
That then goes through a process of the health economics team gets involved, then the commercial team gets involved in looking at the medication, prioritising it and deciding where the funding should be spent in terms of priorities for New Zealanders.
Okay. And you mentioned earlier about the challenges of medication in New Zealand. What are you going to be touching on in your talk today?
Well, I think there's sometimes a perception that Pharmac is out there to stop funding of medication. It's actually not the case. Pharmac set it up to fund medication, and we actually want to fund medication. I suppose one of the key issues I want to focus on is the fact that essentially demand is always going to outstrip our ability to pay, which is why you need an organisation like Pharmac to ameliorate what's actually going on. I mean, the other comment I'd make is New Zealand is part of a global pharmaceutical marketplace. We're actually a very, very small player in that marketplace. I think we're responsible for 0.001% of the total worldwide pharmaceutical market. So we have to be very astute, very careful, and we actually have to think about patients and outcomes and what we really want in terms of medication in New Zealand.
Fantastic. It sounds like they have a lot of hard work to do.
Look, it's not an easy job, it's a difficult job, but I think Pharmac does a particularly good job for New Zealand. If you look at the figures over, say, a 10-year period or the last 10 years, Pharmac has substantially saved money for the country and the health system, which can be reinvested in the health system. At the same time, increasing access to a whole range of medications, from very high-end specialist medications, such as used for rheumatology or oncology or cancer, down to medications that you see every day, such as antibiotics and antihypertensives. So, yeah, it is a difficult job, but I think Pharmac does a particularly good job at sort of allowing New Zealanders to get access to medication.
And a very necessary job, isn't it, as well?
Look, I would argue that it's very necessary going forward. And it's certainly an organisation and it's sort of a way of working that I think GPs as leaders in the primary care sector, as clinical leaders, need to understand. I mean, often as a GP, we focus on the patient in front of us, we focus on what we think is best for the patient. I think at times we need to take a step back, and certainly one of the things I've learned being at Pharmac, we need to take a step back and look at the bigger picture and what's going on and actually what's good from a national perspective. And it's getting that balance.
It is. It's all about balance, isn't it?
It is.
Cool.
It is.
Thanks so much for coming along today, Bryan, and having a chat with us about Pharmac. Look forward to your talk.
Great. Thank you.